Hello everyone. In this short video, let us learn about the water imbalance. The water imbalance can exist in the form of dehydration or overhydration. As the name suggests, dehydration implies it is decreased water content in the body. Overhydration implies it is increased or excessive water content in the body. Now let us learn the pathophysiological concept behind this dehydration and overhydration. So the concept behind this can be very well explained by water tank model of body fluid compartments. So consider in this picture the inlet shows entry of 2 drops of water here, and the outlet shows exit of 2 drops of water. So when the intake of water is exactly equal to the output of the water, this is called water balance. So in this state, this is the level of extracellular fluid volume in the normal state. If you come to this diagram, where you can see the water intake is normal but water output is more. So excessive water loss from the body can happen because of diarrhea, vomiting, etc. So in such conditions, what happens? The water content decreases. So this is a state of dehydration. So what is happening in this case? If you just see, the water content, water level has declined. This is a normal level and this is a water level in dehydration. So it shows the ECF fluid has decreased. So because of excessive water loss, ECF decreases. So because of this, there is increased osmolarity of the ECF, which draws water from the cell, inside the cell. So because of this, cell shrinks. Similarly, if you come to the concept of overhydration in the second picture, you can see the water intake is increased. You can see 4 drops of water are shown, and here only 2 drops of water output is there. So this shows water intake is increased compared to the water output. So this is a state of overhydration. So in this, the extracellular fluid volume increases, and since the water content in the ECF increases, osmolarity decreases. When the osmolarity decreases, the water moves from the ECF into the cell, leading to swelling of the cell. So this is the better model to explain the concept of dehydration and overhydration. Coming to the dehydration. So dehydration is water output exceeds the intake. So the possible causes of dehydration can be because of inadequate water intake or because of excessive loss or both. So the inadequate water intake or excessive loss of water, both can be the reason for dehydration. As you can see, in case of diarrhea, vomiting, excessive sweating, burns, there is excessive loss of water from the body. Diarrhea is loose stools. Lot of water is excreted in the form of stools. Vomiting, you all know, the excessive loss of water through the vomitus. Excessive sweating and even the burns can lead to excess loss of water. Adrenocortical dysfunction and deficiency of ADH can also lead to dehydration. Adrenocortical dysfunction, because adrenal cortex is responsible for production of aldosterone, and in case of any abnormalities of aldosterone, there may be loss of water. And deficiency of ADH. ADH, antidiuretic hormone, which also known as vasopressin, which is produced by the posterior pituitary, and this helps in conserving the water level in the body. In case of deficiency of ADH, there is excessive loss of water. that is called as diabetes insipidus. So because of this, dehydration sets in. So this picture shows the mechanism of dehydration. So there is excessive loss of water from the ECF first, and because of this, osmotic pressure of the ECF increases, and when the osmotic pressure increases, it draws water from cell into the ECF. So because of this, cell shrinks. So the clinical features of dehydration can be decreased ECF volume, increased osmolality and increased osmotic pressure in the ECF, shrunken cells, decreased urine formation. Along with this, loss of electrolytes can also be seen. So the clinical symptoms may include increased pulse rate, low blood pressure, sunken eyeballs, decreased skin turgor, lethargy, confusion, and in severe cases, it may eventually lead to coma and death. Now coming to the overhydration, it is excessive water in the body. It may be because of increased water intake or decreased water output. So the common causes of overhydration are renal failure, where the kidney fails to excrete the water content in the body. It can be because of excessive administration of fluids parenterally. Parenterally means intravenous route. If you are giving more fluids, it may lead to overhydration. Hypersecretion of ADH. You know, ADH or vasopressin is produced by the posterior pituitary, and in case of any tumors of posterior pituitary, there may be hypersecretion of ADH, which leads to excessive retention of water inside the body. Excessive intake of salt-free water is also responsible for overhydration. So this picture explains the concept behind the overhydration. When there is lot of water in the ECF, that leads to fall in the osmotic pressure. If osmotic pressure falls, the water content of the ECF moves into the cell, leading to swelling of cells. Cells swell. So the clinical features include nausea, vomiting, headache, muscular weakness, confusion, and even coma. So the treatment can be to stop the water intake and give hypertonic saline. Thank you.